Greetings, everyone, and happy Wednesday. Welcome to the School of Global Health Management and Informatics Webinar Wednesday, the summer series. A couple of housekeeping items before we get started. To our attendees, please be sure that you keep your microphones muted and your webcams turned off. We will be taking questions from the audience at the end. We ask that you use the chat function to submit your questions at that time. We will address them to the panelists in the last 10 to 15 minutes for the open Q&A session. Please also remember that this is a live event and do your due diligence to keep your personal information protected. For any current students in attendance, this is a UCF event, so all student codes of conduct rules and regulations do apply. Thank you so much, and I'm going to hand it off to our host to get us started.
Thank you so much, Hannah. Everyone, that was Hannah. She is one of our program coordinators for our Executive Master Health Administration program and our Healthcare Informatics. My name is Katie Terry, and I am Head of Communications for the school and your friendly webinar host. I'm super glad that you're all joining us today. Today's topic is Health Informatics. What is IT? The School of Global Health Management and Informatics has two programs that focus on this aspect of healthcare. So first, I'm going to start off with our program directors. I want them to introduce themselves and a little bit about our programs. We'll start with you, Dr. Noblin. Please give us a quick introduction of yourself, the health informatics industry, and a little bit about our undergraduate program.
Thank you, Katie. So my name is Alice Noblin. As you can see from the description, I have a little bit of alphabet soup after my name. The program I manage at UCF is the Undergraduate Health Informatics and Information Management program. And our goal with this program is for students to graduate with the credential or prepared for the credential of RHIA. So they test for that credential soon after they graduate. I've been at UCF as the program director since 2006, and I'm currently an associate professor. I have another hat right now as an interim associate dean for our College of Community Innovation and Education. So I sort of oversee the undergraduate side of our college in the dean's office. So that's kind of been an interesting role for me for the last year and a half or so. So a little bit about the HIIM program at UCF. It's an accredited program, and it's been here at UCF since the 70s. It's one of the original allied health programs, actually, from the old FTU. It came to UCF as medical record administration, though. And as you can imagine, back then, it was more of a paper record-based type program. And now we have graduated, I guess you could say, into electronic records. And that's been because of a lot of incentives from the government and a lot of changes in our industry over the last 10 to 15 years, I'd say. As far as what our students learn about or what health information is, to kind of bring it to this webinar, it's actually the information, the clinical information that is collected on patients when they have a healthcare encounter. So I always tell anybody who wants to learn about health information that anytime healthcare is given in any setting, a record must be kept of it. And so our role as health information professionals is to manage that information, make sure it's correct, make sure it's complete, and make sure it's accurate. And so we collect that information, and that would be on inpatients, people who spend the night at the hospital, or outpatients who might be in a doctor's office or in some other outpatient setting. But that information is collected by that enterprise. Let's say in one case, it could be Orlando Health in the Central Florida area, or it could be Adventist Health. They keep their own set of records on their patients, and they collect all the information about that encounter so that if there's a follow-up needed, and typically, unfortunately, we might go to the hospital more than once in our lifetime, all that information is available for the next caregiver. And then there's also data collected, and the HIM professionals are integral to the not so much the billing side, but the coding side, which is the medical codes that are attached to all the care and the diagnosis. that comes out of a patient's stay. So we collect the information and then we can use that for future decision making and research.
Thank you so much, Alice. I'm going to punch over to Dr. Gurur. He is our intern program director for the Master of Science in Healthcare Informatics. Dr. G, please introduce yourself and give us a quick intro to the HCI program.
Okay, thank you, Katie, and thank you, Hannah. We have our Master of Science in Healthcare Informatics program, which is accredited by KHIM, and it's been in place for the last 12 years. We have graduated a lot of students. We get students from diverse backgrounds, and as instructor and as someone who served as a program director, the biggest challenge is always to keep all groups happy and give them the knowledge and give them the skill sets that they need, which is very critical, because it is the skill sets that we train our students in. They can take those skill sets and either get a job or get a promotion at their workplace if they're already in the healthcare informatics industry. So healthcare informatics industry is a growing industry, especially after the pandemic. The need for healthcare informatics has only grown exponentially. This is the great time and a great place to be if you are a student in the Master of Science in Healthcare Informatics program. And I want to keep my speech a little bit concise today, and I want our alumni to do most of the talking. So thank you very much, Katie.
Thank you. Yeah, I really do like to start out with our program directors, simply because today I'm super excited to announce that all of our panelists are actually alumni of one of our two programs. So it's my absolute pleasure to introduce to you our guests joining us today. First, we have Erin White. She is also one of our adjunct professors, and she comes to us with over 8 years in leadership experience across multiple aspects of the health information management field. We also have Stephen Irby. He is a senior software engineer with USMD Health Systems, and Rin Ann Cassis. She's a business analyst with Allscripts, as well as the scholarship chair for the Central Florida Health Information Management Association. Welcome, panelists. Thank you again for taking the time to be here with us. I'm going to start firing our different questions and we'll get the discussion started. I really want to start with your backgrounds. And where you are in relation to health administration field or the health informatics field. Simply like Dr. G mentioned, everybody comes from a diverse background and somehow lands here. Erin, let's start with you. You've turned your sights on education and helping build future HIM leaders. Can you tell us why you chose HIM as a career?
Sure. It's actually kind of interesting because I originally, and I think a lot of the students who, I went to school with, it kind of also started off in nursing and then decided that this really isn't the right place for me. So I found the HIM program at UCF and was really interested in it because I really enjoyed the healthcare aspect, but I also enjoyed the administrative side of it as well. So I think that's really why I landed with this program, and it's been a great career for me. There's so many different options that you can go to, so many different areas within the field. You can go to technology, working with different systems. You can go work in privacy and security or work on project management. There's just so many different options. So I think it's a great career choice.
For sure. So I'm just going to give everybody a brief takedown. So what was it like going from you were a supervisor for a physician practice, then you went to an HIM director and then a compliance officer? What was that journey like going through that path?
It was an amazing journey. I learned so much and I worked with so many great leaders. It was just, helped shape, I think, who I am today. So yeah, I started off with Orlando Health and I worked as a supervisor in the physician practices. I moved into medical transcription, which can sound a little scary, but surprisingly, it had a lot of different systems. So I learned a lot about IT when I was in medical transcription. And then I took a role as an HIM director. So that was really amazing because I was able to work with physicians really closely and just build up relationships. I worked really closely with the CFO and CEO of the hospital as well. So I was just exposed to so many different things in that role. And that's really how I ended up in the compliance role, because it was, just building the relationships that I had with the senior leaders there and the administrative team to kind of get me on board with that. So it's been a great journey.
That's awesome. Speaking of journeys and how they take you, Stephen, you're one of the ones who started down a very different path and landed where you are now. Can you give us a quick rundown on how you went from forensic chemistry graduate to senior software engineer in health informatics?
Sure. So I graduated from University of Southern Mississippi with my bachelor's in forensic chemistry in 2007, December of 2007. That was right around whenever the economy was starting to take a downturn. There were hiring freezes in states across the country, and Mississippi was one of those, which is where I was living at the time. So I was freshly graduated with a chemistry degree and unable to find any employment with the crime lab that I was trying to get work at. So I ended up applying to every laboratory that I could find in the phone book. I believe I submitted about 60 applications, got on answering the phones at one of our local hospitals. And then within about a year, had transitioned into working in the chemistry department, became involved in an EMR upgrade just for proficiency for learning new systems. And with that, transitioned into LIS administrator. And then as I transitioned to different employers, I just continued to grow that skill set and responsibility.
Yeah, that's pretty amazing. As Dr. G mentioned earlier, it's amazing how you can go from one to the other. When I was reading your background, I was like, wow, forensic chemistry and now into software engineering. That's pretty amazing. Skipping over to Renan, I know you had the opportunity to learn about both the health information management and health administration because you did minor while you were in your program. What about the health information management drew you down that path?
I also have kind of a weird story. I started off at UCF as an IT major. So I always was interested in, software and the IT side of things, but I didn't feel fulfilled. I really like healthcare and I wanted to kind of mix the two. So that drew me to the catalog and I was flipping through, seeing what kind of majors might have combined my two passions. And I read health informatics and information management. I didn't really know what it was. So I looked into it a little bit more and it sounded like a good fit for me. So that's how I came across the program. And it definitely was a good combination of my interests.
How would you say that learning about the two of them together has benefited you?
So it got me to the career that I have today, which I also didn't know existed. So it opened the door for that. And I really like my job. It allows me to be creative and then use my background in HIM. That's definitely benefited me. And then I'm also, in the software scene and working with applications and designing different applications. So I really enjoy that.
That's awesome.
Yeah.
Stephen, I'm going to jump back over to you really quickly. As a senior software engineer, you work on applications and data for laboratory operations. Can you give us an example of something that you and your team would work on? Like, who would you say is the end user? And what do you think the biggest difference or biggest challenge in health IT?
So to start out with, our end users are definitely the front end patient-facing staff. So your nurses, your providers, your front office staff who are actually working in the applications. As far as, sorry, that was three questions there. Can you repeat that?
Yeah, sorry. No, go ahead. So first, what's an example of something your team would work on? And you mentioned that, right?
Yes. So in the past year, one of the biggest things that I've been working on, since I'm the primary subject matter expert for our laboratory applications, has been all of the COVID testing that's been going on. As soon as COVID hit, there became state and federal requirements for reporting of any type of testing, which led to a mad rush on every reference lab out there. It was very difficult to get interfaces up, get new orders built, get reports created, interfaces for the reports, all of that. It was a large undertaking that we're still working through.
Right. So, using that as an example, who would you say is the end user of that kind of project that you're working on?
So as I mentioned, the patient-facing staff, definitely, because they are interacting with the origination data. However, also our external customers, such as the state reporting agencies, the different reference labs. There's quite a large number of them. So it's both upstream and downstream users. I just consider ourselves a data steward, and we try to keep everything as clean and nice and concise as possible so that the end users of the data have a good experience.
Yeah, for sure. And like you mentioned with the COVID-19, that's definitely a challenge that, software engineers and those in the informatics in health have to deal with that your typical IT situation wouldn't necessarily have to deal with. So that's awesome. Renan, can you give us an example of your day-to-day as a business analyst?
Yeah, so a lot of meetings, a lot of calls. I work with clients directly. So a lot of our applications, we customize them per client. So I work with them to collect their business requirements. And then a lot of my work is writing the technical requirements that I would pass off to the development team.
Gotcha. Can you tell us a little bit about, as an active member with AHIMA, because that's a big one for a lot of our students, all of our colleagues that are working in the industry. Can you tell us a little bit about the scholarship opportunities for HIM students?
Yeah, so we just had the last scholarship phase close. It will be opening up again shortly. We transitioned everything this year to online, so you can upload your application, all the documents online. We didn't have any applicants this past time, so nobody was able to get the scholarship. So hopefully this time we'll try to reach out a little bit more, but the money is there. The opportunities there. I got the scholarship when I was a student. It's not really a hard application process at all. So I would encourage you all to look out for that. We'll be posting, more information on our Facebook page. So look out for that.
Yeah, what a benefit to our attendees today. You're no applications. So remember that when it comes around.
Yeah.
One of those. Erin, I want to circle back around to your experiences. As a director, what do you recommend to students getting ready to find their way into the job market?
That's a great question. What I always tell students is you should start working somewhere. Just get any job. It's, you want to have some kind of experience, and even if it's not a position, in healthcare or in HIM, you can always relate that experience to maybe a future position in HIM that you want. But I definitely, found as I was graduating, and I think as we were trying to, hire new graduates, it was always more difficult to kind of have them relate experiences during the interview process if they didn't, have any type of work experience. So that's always my number one recommendation. My second recommendation is always to be involved with, like your local association, so CFHIMA, or get involved with AHIMA or FAHIMA, or whatever local associations you have related to HIM, and then just start building relationships, because I think that's how I got to where I am today, is definitely building relationships and just getting your name out there, and volunteering for things. And it's okay to step outside of your comfort zone. That's probably the biggest thing, is take a leap somewhere, and it'll lead you to a good place.
It's very good advice. I want to talk a little bit about some cool things. So there are a lot of advancements occurring in HIM every day. We have the HIMSS that happens every year. We look at all the technological advancements, application advancements, et cetera. And recently, just to brag a little, Dr. Gurupur, Dr. G, you and Professor Emeritus Dr. Tom Wan received the school's first US patent for a new system. And we're so proud. Having gone through that process and teaching on informatics, what would you say gets overlooked about the healthcare informatics industry?
So healthcare informatics industry is one of those industries that is changing very quickly. The field of healthcare informatics changes has changed in the last 2-3 years so rapidly that we have to go back and change our curriculum. So, doing innovative research, building cutting edge technologies, you are at the forefront of things. So which makes you feel comfortable a little bit. But, having said that, if you are a teacher in healthcare informatics, you also got to be a student of healthcare informatics at the same time, because the field is changing. If the field is changing, you got to go out and learn more. So, and the way to learn more is by doing research. And in my case, I have been fortunate enough to get some really good students do research with me. I published a lot of papers with students. That is one of the things that I like to do. And, and this benefits our students as well, because, they can go out and say that I'm a graduate of this program where students and faculty members have got patents and awards and all the other good stuff. So that helps them, build their reputation to get a better job. I believe that's my belief.
Thank you. It's really important to note it is ever changing and ever advancing. Dr. Noblin, on preparing and changing and doing things to help learn. Our undergraduate program also helps prepare students for certification exams, which both of our undergraduate alumni attending today have. Can you talk a little bit about the RHIA and the CCA?
Sure. So the CCA is actually Certified Coding Associate, and it's kind of an entry-level coding credential that we actually have embedded in one of our courses. In HIM programs, we have several internship opportunities. And at UCF, we have one called Professional Practice 2. It's the middle one. And as part of that course, we actually prepare the students to take the CCA exam, and they're required to take it sort of as their final exam for that course. So our goal is that they would graduate with a credential. So that's, the end goal is the RHIA. The CCA is sort of the midway goal. And it's a foot in the door for some jobs. And it's a credential, and it's not, it's definitely not the end game, but it's definitely a good start for a lot of our students, and especially those that want to go into provider or practitioner, like physician practice management, those type of scenarios. But then for the RHIA, we do a lot of preparation through our courses. Of course, our curriculum is built around most of the requirements. And, we push to get the students prepared and ready. So as soon as they graduate, or maybe right before, that they're ready to go and they can go ahead and take it. So when they graduate, then they have two credentials, both the RHIA and the CCA. And that just builds a lot onto their resume. A degree is one thing, but credentials are more industry specific. And they, the employers in the Central Florida area look for, especially the RHIA, for certain level jobs in HIM. So you can get an entry-level job. You can get a clerical, I hate calling it that, but an entry-level clerical type job, but you just can't advance necessarily above that into the next rung of your career if you don't have those credentials to kind of really show that you are committed to this, profession. And we realize that there are a lot of ways to go once you get your credential. You don't have to go down the one path that you start at when you graduate, but you do need to get those credentials. If those, if you're in a degree program that a credential is available in, as part of that, you need to take advantage of that. It's so frustrating when, when people don't graduate and take the credential exam and don't do that next step right away. Because it really does open a lot of doors and gives you great opportunities for the future. So, and I was also, when you were asking Aaron about getting started, Renan got started, and this is a great opportunity for any health student at UCF in the health center, the health services, or it's called Student Health Services. So she actually started working there, and they hire students. So maybe Renan can tell us a little bit more about that sort of entry-level opportunity as you're a student. So you can actually get that experience while you're on campus and, kind of kickstart your career.
I got started in the HIM department within the Student Health Center. I was working specifically with immunizations. When you first enter the university, you have to provide, proof of immunization. But working in that environment really introduced me. I made a lot of friends, and they were in their careers working in the HIM department. So I got a lot of connections that way. And I still keep up with a lot of the people that I met while I was in that job. So, and they're, professionals, they've moved on from there. And so those connections are really good to have, especially as a student. It introduced me to a lot of, what I did want in a job and maybe what I didn't. It helped me figure out, where I wanted to be within HIM.
Yeah, that entry-level experience, especially while you're a student, is invaluable. That's why we're so big on internships, et cetera. Going back to the RHIA, both Renan and Aaron, what would you advise students preparing to take those exams to do? Aaron, we'll go ahead and start with you.
Sure. So just like Alice mentioned, I didn't wait. I took mine right away, which is definitely what I would recommend you to do. I was lucky enough to start my career as a supervisor before I graduated from UCF. So I had to have the RHIA within 6 months of my employment. So I had no choice. I had to take it, but I would definitely recommend to take it right away. For the CCA, I did wait about 2 years, but at that time, it wasn't a part of the HIM program, so I just did it on my own a few years later. But as far as studying and things like that, the information is fresh in your head right after school. Plus, the study guide that AHIMA has, that's really what I did, is I just went over all those questions, I think thousands of times.
Renan?
Yeah, I would agree. I did it right away too. Like Aaron said, the information's fresh in your head, and it's most valuable in the beginning when you're looking for a job. And I also did those AHIMA practice books front and back thousands of times. I think that's what really helped me. It's mostly just learning, how to answer the way that they want. So I would say the AHIMA practice book, and then just doing it as soon as you can.
All right, well, everyone heard it here first from 3 different people. Do it very soon after you graduate to get that fresh information there. Staying on the education and certification, Stephen, you returned to school to get your master's in healthcare informatics, so you are an alum of our HCI program. What was that transition back to the educational realm like?
It was very interesting and kind of intimidating at the same time. Obviously, I work in IT, and we don't work normal hours. You work the hours that are needed to get the job done. If that's 8 hours a day, 15 hours a day, whatever is necessary. Well, that's whenever I started, and then COVID hit, so that workload tripled. Plus, going through school at the same time, it was definitely a struggle at times. But we had the support, and the courses were laid out in a way that you could read ahead for some, and kind of prepare. You knew when your deadlines were, and I was able to manage time appropriately after hours to be able to get everything done. And I'm very glad to be done.
I think a lot of people are like that. So, speaking on that, what would you recommend to those thinking about pursuing a graduate degree in the field?
Mostly research or different options. Talk to people that are in your field that you know of, who have the degree that you're looking for. Get their feedback. What did they do? Where did they experience? My experience with UCF was great. My decision for choosing UCF was based on that it's online. It was specifically designed for people like me, who working professionals, so that we could manage the course load on our own time. So really just researching your different options and comparing what's going to be available to you.
Yeah, for sure. Sticking on your advice, what are 3 skills that you think our current or prospective students could cultivate to have the best opportunity when they're ready to either advance their career or get into the field?
So one of the things that really helped me in my career, obviously I got my master's later, and I had a lot of on-the-job training. However, the Dr. I forget his name, the SQL class where we're going through the SQL databases. If you're trying to go the IT route, the majority of all EMRs and applications, they all work on relational databases. Having that basic understanding of how things communicate and talk and relate to one another is a great thing. Another really good skill is customer service skills, because whenever you're, if you start out in help desk, let's say that you're just coming out of school and trying to get a job within an IT department to do these things, generally you would start as a help desk or at a lower level thing where you interact with the users more often. So being able to, appropriately respond to a provider who's maybe not very happy at the moment with whatever you're working on is a great skill to have.
That's awesome. Thank you. Erin, coming back to you, what are the, I'm going to ask the same questions, but on the other side of things, what are 3 skills that students could cultivate to move into the health management side of it?
That's a really good question. There are so many essential skills that we need. I think specific for HIM, you definitely need to have good organization skills, because there's just so much that you're doing at one time. Another one is just, kind of what Stephen said, is the customer service skills, because you can really take that anywhere. I mean, if you go the route that I went, my job in any job that I had, I was always talking to physicians. So just being able to, take a step back and kind of relax and know that you have to, they are the customer kind of. So I think that was really, really helpful, and just as you're going through and trying to build those relationships as well. So those are probably the 2 skills I would say.
I gotcha. So just staying on you, Erin, what would you say was the toughest part of your career path? Was it, going from college to career, or from position to position?
No, that's another really good question. I think it was more just, once you get into that new role, it's learning about the new role and taking the time to learn about the current processes. I was always had a very innovative mindset, so I would come in and learn about the process, and then the biggest thing that, everyone else is going to resist is change. So that's probably the biggest challenge, is when I first went into a new role, if I tried to, change something too quickly, that became a challenge. So you really have to earn the trust of your employees or the physicians or your peers, the administrative staff, before you try and go in and make any changes.
It's good to know. Speaking of challenges, Stephen, what do you think? I mean, obviously other than COVID, because that's been a huge challenge, but what do you think one of the biggest challenges facing those in health informatics and health information management is?
I would say the rate of change, right? Like Dr. G mentioned, every healthcare is constantly changing, whether it's new regulations, new workflows that are needed in the clinics or in hospitals. Just being able to adapt, understanding what functionality and what options you have available to you, and thinking outside the box. And like Erin said, being innovative, being able to take the tools that you have available to you and apply them to the workflow that's needed to be able to resolve issues.
Gotcha.
And develop new processes. Yeah.
For sure. So Renan, similarly, what do you think is the biggest challenge facing those going from receiving their degree to now going into this ever-changing industry?
Definitely adjusting. I mean, I also entered, my job at a weird time for the company. They're being acquired. So just learning the processes and kind of just getting into your role. it was definitely difficult, and especially with COVID, there's been a lot of changes within our products. We've had to create new products to accommodate, the new environment. So that's definitely been difficult, but it's always changing, like we said, so it doesn't really end at any point in time. It just keeps evolving, and you'll just adapt.
Yeah, that makes a lot of sense. I really like that all of you are echoing the fact of it changes all the time. Adaptation is going to be your friend. On that, I kind of want to pose a question to all of our panelists. Just think on it for a second, but what would be your one sentence motto or one thing that you would say to people trying to get into the industry or going from being a college student into the career, just like a one sentence motto that would take them. And while you think on that, I'm just going to let our attendees know we're getting ready to go into the open forum Q&A and remind you that we're going to use the chat function. So you can go ahead and start typing in your individual questions for our panelists there while they're thinking on their one sentence motto, and get ready for that. I want to go ahead and start with our program directors because they are the all-knowing. Dr. Noblin, what would your one sentence motto or one piece of advice be?
So the thing that we stress from the get-go is networking. It cannot be overemphasized in the health information management industry. You can't overemphasize networking. The value of it, getting to know people in the profession who can help mentor you or give you, sideline advice, whatever it be. But mentoring is just such a big part of the industry. Before we got started today, I was talking to Aaron and Renan a bit about the Florida Health Information Management Association conference, which was actually live this week, Monday, yesterday, and today. And I attended and saw numerous UCF graduates, advisory board members, and other stakeholders and supporters of our program from around the state. And, it's all, it's all one big community, but you have to make the effort to be part of that community. And the community will embrace you, but you can't, you have to take that first step.
That's a really good, take the first step.
Sorry, I got a call in the middle of that. Yeah, take that first step and make sure that you, if you get a mentor, that you're a good mentee, that you reach out to your mentor. So that's it, networking, my keyword.
Thanks so much, Dr. Nevlin. All right, Dr. Gurif or Dr. G, what about you? What would be your one sentence advice or motto for students or those looking to go further in the field?
Okay, I just had to unmute here. So my one sentence or model would be try to be a good learner. That's what I say. Try to be a good learner. Be a good listener, be a good learner, and ask questions.
That's excellent. Thank you. All right, we'll go down the line. Stephen, what about you?
There we go. Unmute. So obviously, I was thinking, never be afraid to ask questions, just because that's, to me, the number one way that I've learned most of what I do on my job. I've got 13 years in the industry in laboratory IT. I'm branching out now. And coming from a non-IT degree, it was all, you got to ask questions. You got to ask questions to the right people, which goes back to Dr. Noblin's networking. One of the best things I ever did was make a good LinkedIn profile and connect with as many people in my niche as possible and ask questions to as many people as possible.
That's excellent. Thank you, Stephen. Renan?
I would say be involved, kind of mirroring what Dr. Noblin said. I attended all the conventions. I was active in my student association at UCF, and that all ties into networking. Really, networking was the big thing for me, and it was how I was able to land my job.
Awesome. Thank you. And Erin, last but not least.
Yes, networking for sure is always number one in my book. But I think the second thing is just to step out of your comfort zone and, embrace feedback, whether it's positive or negative, take it and do something with it.
Awesome. This is what I love so much about these panel interviews is, doing the one sentence thing. We just gave some very great overall advice with each of your little tidbits of just your experience. And that's an overall thing that maybe just talking to one person isn't going to get students or those trying to build their career. So thank you guys so much for that. All right, we're going to go ahead and go to the open forum. I see that we already have a few questions. So I'm going to go ahead and fire them at our panelists. So the first one, as far as internships, what is your best advice to acquire internships and what skills should we learn to stay competitive when applying to internships? I'll go ahead and give this one to Erin, Ren-Ann, and Stephen, whatever, answer you have to that.
I can go first. My internship was amazing. It was set up through the UCF program, so I didn't really have to search for any. I kind of just put my name down on which employer I wanted to have an internship with. It was a month long, and it was a full-time, Monday through Friday internship, but that's where I ended up getting my first job. So it was worth it, and I just met so many amazing professionals there, and I also developed a lot of skills during that time as well.
Yes, both of our programs do require an internship function to them, specifically for that reason that she was talking about, is that's a foot in the door. As Dr. Noblin had mentioned before, there are so many things, it's that foot in the door. Stephen, I'll go ahead and pose to you, this goes back to those skills, but what's something that you think they should focus on while they're in their internship?
Going right back to asking questions. This is your perfect opportunity with people in the industry, in the area that you're wanting to work in. They've got the experience. Use their experience to gain your own knowledge so that then you can have your own wisdom. So in that, it goes back to ask questions. If you don't understand something, ask for more detail. Expand your network while you're there. Don't just get stuck with the same people that you're shoulder to shoulder with. Move up the chain as you ask the questions.
Yeah, for sure. That definitely plays into the being a good learner, is asking those questions. This next question is for Dr. Noblin or Dr. G. Are there any opportunities to study abroad in the HIM programs?
I would give it to Dr. Noblin.
Okay, well, I was going to give it to you. So what we know for sure is that our school director, Dr. Ho, does do an internship in Taiwan. Obviously, that's been put on hold for a couple of years, but that is a health administration oriented study abroad. So my advice would be, if you are passionate about getting involved in a study abroad, is to approach Dr. Ho about your what your interest is. And I believe that it could be, it could be made to happen, that, it could be a more informatics oriented experience. I don't believe that everybody that goes into a study abroad program is in a exact, everybody does exactly the same kind of output or whatever. So that would be my advice. We actually don't have one that, within our school, we don't have a specific study abroad opportunity, but I believe that you could tailor that through Dr. Ho and make that happen.
Definitely, I'm going to echo Dr. Noblin there. We are now the School of Global Health Management and Informatics. And so that's a big focus for us, is bringing in that knowledge, that information, and getting that exposure on the global scale. So we do have a lot of things, even if it's not a full study abroad program, we do have partnerships with other universities across the globe. One specifically is in Colombia. And we do an exchange program for a week long, and they do hit on aspects of the informatics industry. So like she was saying, if you want to get involved in those different things, you can tack on to those and curate it to the informatics side. All right, so we'll go ahead and move on to the next question. What was the first job you received in the industry upon graduating? I think we already did talk to Stephen and Erin about this. Brent Ann, what was your first job right after graduation?
So my first job is the one that I have now. I'm a more recent graduate, but I've been in this position for 2 years now, and I'm a business analyst at Allscripts. So Allscripts, I actually heard about them during my internship. I did my internship at Orlando Health, and Orlando Health at the time used one of Allscripts' EHR softwares. So when I was looking for a position, I kind of came across Allscripts' website. It sounded familiar. Looked at the job descriptions and found, one that it didn't sound like super like I was qualified for it, but I just went ahead and tried and I got the position. And my HIM background has definitely helped with that. But it is a little bit non-traditional. But yeah, that would be my first job since graduating.
Well, that's definitely an excellent point. Again, hitting home, that internship is a great bridge. That internship is a great bridge to get into the next position, into the industry. The next one I'm going to pose to you, Erin. What are some tips you have to reaching out to people in the field and more ways to network, that big key point?
The biggest advantage that I had networking was just volunteering at first for, the FAHIMA conference. I volunteered for that for a few years while I was in school. I also was a part of the student HIM membership that we had. I was going to the CFHIMA meetings because that's the region that I was in. So I would go to those every time, they had a meeting, and there were so many professionals there that I was able to meet. What Stephen mentioned earlier about creating a LinkedIn account, I think is really helpful as well. But, while you're at those associations, you can just go and talk to professionals and kind of, get their information or business card or something, and it doesn't hurt if you find a connection with someone to ask them to be a mentor as well. I've done that too, and it's really helped me out. But then just going, eventually getting my foot in the door and starting my first job from there, I just tried to network with as many different people as I could, even while I was at the hospitals. And if it was somebody who maybe I didn't work with all the time, I would just go and talk to them and really step out of my comfort zone. And I'm actually a pretty shy person, so it ended up working out for me. But you do have to take that step to, go introduce yourself and just ask somebody about what they do.
Don't be afraid to ask the question, like Stephen mentioned earlier.
Right.
Speaking of you, Stephen, I'm going to fire this next one at you. Since you mentioned the numerous changes in healthcare, what recommendations do you have to manage ambiguity?
So with my lab background, we don't like ambiguity. We like everything to be out to a certain number of significant digits. We need repeatability. So it goes back to asking questions. If you're not getting the level of detail that you need, go back, ask additional questions. Sometimes you have to ask the question a different way. Instead of just a yes, no, ask, what would you do? How would you like to see this? What kind of layout would you like to see? So that you can document those answers and reduce the level of ambiguity. If whomever you're talking to doesn't have the answer, let's get the right people on the call. Let's get the decision makers at the table to be able to make the decisions and tell us exactly what we need to reduce that ambiguity. Ambiguity causes mistakes and delays projects.
That is such a good perspective. Thank you so much, Stephen. We'll go to this next one. This is a really good question, and I really want all of our panelists, pipe in with your advice here. What are the tips to find out your fit in HIM? I am a new medical records manager, but I don't think I want to do it forever. But at the same time, I don't know what I want to do.
I can kind of relate to that. So I started working in the HIM department while I was a student, like I mentioned before, and I kind of saw what those were doing around me, and I was kind of like, I don't want to do that for the rest of my life. I've, was there for a couple of years, like kind of knew the job inside and out, and I was like, okay, I don't think I want to work with medical records. So my biggest tip would be to try new things. I guess I kind of applied for this job not really knowing what it was, and I got it, and I actually ended up really loving it. And maybe I was just lucky getting it on the first try, but definitely look into the non-traditional areas of HIM. Attend webinars like these where you can learn about what different HIM professionals do that aren't necessarily working with medical records. And then maybe if you're interested in like the software IT aspect of HIM, go to the different, like the EHR vendors, their websites, and see what kind of jobs they offer. That's what I would say.
And I would say also HIMSS, you know, would spread your wings a lot outside. I mean, you know, we've talked a lot about HIM specifically, but HIMSS has a regional association that covers Central Florida all the way to the north end of the state. So it's quite large, and there's quite an opportunity to network within that group, within a lot of different healthcare areas, IT areas. So I feel like that's another really good opportunity for networking and kind of seeing what some of the opportunities are. And I think that's a big part of it too, is just understanding what all you can do. And like Renan said, kind of getting outside your comfort zone there and applying. I have to tell you, when I was in school, I never thought I'd be an academic. This is not where I saw myself landing and where I really thought my passion would be. So it took me quite a few years to find my passion. So, you know, give it time and, you know, gain experience, and always look at whatever experience you gain as positive. So, you know, take away the positive parts of what you've learned as in your management role to the next role. And then that people like to work with positive people. I guess that's what the bottom line is. I heard that at my conference yesterday. You know, everybody enjoys working with not happy, but positive people. So always be positive about your experiences and take the best you can to the next position. And, you know, it might take a while, but you'll find it.
Thank you so much, Alice. That's definitely true. We love working with you because you are very positive. But this last question I'm going to go ahead and pose to you is from one of our attendees. What would you say makes a good competitive candidate seeking admission to the HIIM undergraduate program?
Well, a good competitive candidate has all our prereqs done. That's very helpful. We're not looking for work experience. You do have to write a short letter of kind of intent of why you're interested. So we kind of want you to look around, you know, go do some Google searches to learn about the profession. But we do have some, you know, you have to take anatomy and physiology for our program. You also have to have financial and managerial accounting, statistics, and a CGS class. Now, you don't have to have all those complete before you apply, but the more you have complete, the better your chances are to kind of get in and hit the ground running. But, you know, we're looking for students who are interested in healthcare and helping patients with the information, you know, making sure the information that's gathered about those patients is accurate. And so it, you know, there's not one mold of a student that we look for, but we certainly, you know, want you to want this as a career path. And we do our best to make it happen for you once you get here.
Thank you so much, Alice. And that I kind of have it here. If you want to find out more information about that undergraduate program and that application process, it is on our website, and you can contact the email addresses for both our undergraduate and our graduate program. I want to thank everyone for attending with us today. It has been excellent. To our panelists, thank you so much for being here. All of your perspectives are so appreciated, and getting those different perspectives is invaluable to our attendees. I can guarantee that. Thank you to our attendees for your great questions and keeping the conversation going. Of course, this is our summer series, and we will have another one next week. It's focused on the global health aspect. So for those of you that were interested in the study abroad and getting that global perspective, next week's going to be the week for you. Again, thank you to our program coordinators and all of our panelists for joining us today. It's been a pleasure. I hope you all have a wonderful day, and we will see you next week. Bye-bye.
Thank you. Bye.